Hi everyone, welcome to Key Concepts, a new YouTube channel that is all about explaining medical concepts. We are going to try to go through every disease, define it, explain it, and most importantly, talk about its treatment. I hope I'd be able to simplify the concepts and help you with your studies, so let's jump right in. For today's video, we will talk about major depressive disorder, or unipolar depression, or clinical depression. They are all one serious mental disorder with an estimated lifetime incidence of 18%, more common in females than in males and more common in young adults. It is characterized by a depressed mood and loss of interest. Activities that you used to enjoy may turn into burdens that you cannot bear to think of. So what causes clinical depression? There are a bunch of factors that cause depression, including genetics, social factors, and psychological factors. So people with parents or family members who experience depression are more likely to experience depression themselves. As for the social factors, it can vary among individuals, ranging anywhere from having poor social skills to bullying in school, basically anything that has to do with the environment. Psychological factors are all about patterns of thinking. Some people can only see the glass half empty. This is an example of a negative pattern of thinking. Other examples include early life losses, lack of self-esteem, and difficulties in managing personal losses. In order to diagnose a person with clinical depression, American Psychiatric Association set up a criteria in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. 5 of the 9 following symptoms must be present most of the day, nearly every day, either by observation or report. So either someone observes that the person looks sad or the person reports feeling sad and empty. The 9 symptoms can be easily remembered by me. Not just me, but you too, by remembering the word me, which stands for mood and energy are low. SIG, as in signal, which stands for sleep disturbances, interest is lost, and guilt. CAPS, which refers to concentration difficulties, appetite changes, psychomotor agitation like pacing and restlessness, and suicidal thoughts or attempts. And as I mentioned earlier, in order to diagnose a person with depression, we should have A. 5 of the 9 previous symptoms must be present most of the day, nearly every day, either by observation or report, during the 2-week period. It has to be during 2 weeks. B. Impairs their daily life activities, and C. Not due to another medical condition or substance abuse. It cannot be better explained by another mental disorder such as schizophrenia, and it is not a manic or a hypomanic episode. So how do we treat clinical depression? For the treatment of clinical depression, there are 2 parts: the non-pharmacological interventions, which include cognitive behavioral therapy, interpersonal therapy, psychodynamic therapies, talk therapies, and the pharmacological treatment, which is split into 2 parts: the first-generation antidepressants and the second-generation antidepressants. In this part of the video, I'll go over the first-generation antidepressants, starting with monoamine oxidase inhibitors, also known as MAO inhibitors. MAO inhibitors were introduced in the 1950s as the first drugs for the treatment of depression. They are effective but with many side effects, so they've been replaced with second-generation antidepressants. An example of a MAO inhibitor is selegiline. Some side effects include sexual dysfunction, sleep disturbances, dry mouth, stomach pain, urinary hesitancy, which is trouble starting the urine flow or maintaining it, headache, and involuntary muscle jerks or even muscle cramps. One key thing to know is that a hypertensive crisis can happen after patients on MAO inhibitors ingest foods containing tyramine. So what is a hypertensive crisis? A hypertensive crisis is a severe increase in blood pressure that can lead to a stroke, a heart attack, or a kidney failure. Extremely high blood pressure, a systolic pressure of 180 millimeters of mercury or higher on the top, or a diastolic pressure, which is the bottom number, of 100 millimeters mercury or higher on the bottom, can damage the blood vessels, leading to a stroke, a heart attack, or even a kidney failure. And the food containing tyramine are aged food, such as aged cheese, wine, sauerkraut, soy sauce, and cured meat. Signs and symptoms of a hypertensive crisis include headache, neck stiffness, nausea and vomiting, sweating, sudden nosebleed, dilated pupils, photophobia, tachycardia or bradycardia, and chest pain. And now we're going to take a look at a hypertensive crisis case. A 63-year-old man has taken an antidepressant for the past 3 months. He is on no other medications and is generally in good health. After attending a party where he consumes wine, bread, and cheese, he is rushed to the emergency room with tachycardia, headache, and a blood pressure of 180 over 120 millimeters of mercury. Which antidepressant is he most likely taking? And we have a few options. Notice how he was attending a party where he consumed wine and cheese, plus his symptoms with tachycardia, headache, and high blood pressure. He's having a hypertensive crisis which is caused by a combination of MAO inhibitors and tyramine-containing food. So the answer is phenylazine because it's a MAO inhibitor. Finally, we reach tricyclic antidepressants, which are another type of the first-generation antidepressants. Tricyclic antidepressants, also known as TCAs, were introduced in the late 1950s. A few examples of TCAs are amitriptyline, clomipramine, imipramine, doxypen. Some side effects of TCAs include fast, irregular, or pounding heartbeat, blurred vision, constipation, dry mouth, sedation, decreased seizure threshold, and confusion. And you need to keep in mind that the first-generation antidepressants are not as used as before because of their side effects. And this concludes the first part of this video. I hope I was able to simplify the concepts. Tell me what you think in the comments below, and I hope to see you in the next part. And until next time, stay happy and healthy.